Hello, and welcome to Lactation Design, facility solutions for supporting breastfeeding in the hospital, the community, and the workplace. My name is Tammy Thompson with Institute for Patient-Centered Design, and I will be facilitating this webinar with my colleague Trinity Kahn. The Institute is a nonprofit organization established to develop and inspire creative design solutions that promote healing and wellness. We operate primarily through the services of volunteers who are practicing professionals in the fields of healthcare and design, as well as patients and parent volunteers. Our newest program, the Mom Friendly Network, was developed to raise awareness in the facility design community of the needs of mothers and babies, and to educate the public on design intervention steps that could improve breastfeeding rates in the United States. This program is funded in part by the March of Dimes of Georgia Community Award to provide resources and tools for breastfeeding accommodation and support. I'd like to allow the presenters of today's program to introduce themselves. Julie?
Thanks, Tammy. Hi, everyone. My name is Julie Zitter of GSC Architects in Austin, Texas. And today I'm co-presenting material with Keena McCarty of Akina, Inc. on our new standard for lactation accommodation in building design. We realize that women are challenged in maintaining their decision to breastfeed due to inadequate facilities. Our companies over the past 3 years have co-developed a new standard to give back privacy, dignity, and choice to the working mother from evidence-based research and best practices. About me, I'm a registered interior designer and a senior associate here at GSC Architects. And I'm very passionate about this topic since I chose to milk express when I returned to work with each of my 3 children. I'm very fortunate to be working at a company that sees the benefits of providing a place that maintains women's dignity without sacrificing their choice to continue breastfeeding. This experience has provided me the insight to design multiple milk expression rooms for corporate campuses. And I continue to collaborate with Akina's engineering team on the design of the Lactate, which is a worksite milk expression specialty fixture. Keena?
Thank you, Julie. Hi, my name is Keena McCarty, founder and CEO of Akina Incorporated. I'm a published author and subject matter expert in the area of worksite lactation accommodations. I designed the first lactation room at the University of Texas in the early 1990s. I've been involved in worksite lactation accommodation for over 20 years. I nursed my 2 daughters and expressed milk at work and on campus during graduate school, so I've got a broad understanding of the barriers to breastfeeding for nursing mothers in multiple settings, especially the work site. Out of this background, I formed my company, Akina, to provide products and services in designing optimal lactation accommodations. In particular, we've collaborated with GSC to establish a new standard for lactation accommodation, design the Lactate, a patent-pending research-based milk expression console, as well as universal signage for milk expression rooms. Melissa?
Thank you so much, Keena. Hi, everyone. I'm Melissa Morgan with DeKalb office, based out of Atlanta as well as Birmingham and Tennessee. I am the manager of dealer design services with our company, and like Julie and Keena, decided to breastfeed my daughter and express milk once I returned to work as well. I've designed numerous mother spaces, mother's rooms, and many healthcare projects that we've worked on as a company, as well as designed the mother's room that is currently in use in our showroom today. Our solutions are furniture and architectural solutions based, of which we will see some of those samples today. Thanks so much.
Before we get started, there are a few housekeeping items that I'd like to cover. This program is registered for one Health, Safety, and Welfare Continuing Education Learning Unit by the American Institute of Architects. Architects may submit their AIA numbers through the quiz registration following the course. All others may request a certificate of attendance through the same form. Unless otherwise noted, the following content presented is the property of the respective presenters. Please request permission before duplicating or distributing this material. The contact information for each party will be available on the course handout. Finally, we would love to have your feedback on this session. Please feel free to leave your comments on the course discussion page. We also welcome your suggestions for any other resources for developing lactation spaces.
Now let's get started with 2 quick polls. Please tell us your role in lactation. Trinity, if you would please start the poll.
This poll has been launched.
Okay, I'll give it a couple more seconds, and we'll close the poll and share the results. Okay, and then we'd also like to know, what region are you located in? Trinity, if you would, please.
This poll has been launched.
Thank you. Okay, we will give it a couple more seconds. Wow. Very interesting results, and we'll go ahead and share those. Okay, great. So in our research on the subject of lactation design, we've actually noticed that lactation rooms are often inserted as an afterthought in the design process, and we would really like to challenge designers and building owners to learn more about the needs of mothers and babies, not only to promote better lactation rooms, but also to support breastfeeding in other spaces. So we'll show here, we really will start with healthcare facilities. This image shows a mother-baby ward from Fabella Hospital in the Philippines. From a design standpoint, this layout actually maximizes the number of postpartum beds to meet the needs of the patient population. So it's not really hard to see why breastfeeding initiation rates are favorable in this type of environment. But in the U.S., design is quite different. There's really an emphasis placed more on the consumer experience. Key factors include things like privacy and family involvement and creating that memorable birthing experience for the mother and the family. While we are advocates for the private patient room for several reasons, such as infection control, privacy, and safety, and private rooms are actually required by code for most new construction, hospital construction, there are some disadvantages for mother-baby couplets that are inherent in private room design. And this is what we mean. Separation of mothers and babies is the primary disadvantage for this type of design, and it directly impacts breastfeeding initiation. To mitigate these circumstances, we encourage designers to use strategies that can reduce mother-baby separation. This is a hybrid postpartum NICU suite that we have proposed to the profession. It requires that the postpartum and NICU units be adjacent when space allows, but it actually enables the creation of 1 or 2 adjoining suites for mothers who require an extended postpartum recovery. So this would be the postpartum wing, and this would be the NICU wing, the adjacent, and at the corners where they intersect, there's an anteroom designed that would allow the mother or the family to move into that patient's room strictly under nurse supervision, so this door will be locked. And there's also a viewing window from the mother, so the mother is able to see that patient's incubator from her bed. And so this is a wonderful option for providing this type of connection where the mother and baby and family members are able to adjoin with that NICU space. And while our proposal is conceptual, this is actually a practice. This is actually in practice. One of our listeners sent us this family care suite at Catholic Medical Center as an example. And among the benefits that they've listed, they actually report an increase in exclusive breastfeeding among patients housed in this room. So there's the incubator and the postpartum bed in the same room. Also, here's a case study from the University of Alabama in Birmingham, where more commonly seen design accommodations include labor, delivery, and recovery rooms equipped to enable newborn procedures to occur right there in the room with mom, as well as immediate skin-to-skin and breastfeeding initiation. UAB also has the largest private room NICU in the country, providing rooming in for parents of NICU patients and supporting breastfeeding. UAB has a lactation consult room designed to accommodate families returning to the hospital for breastfeeding help. So this image shows a TV designated for siblings who come along with parents and the newborn in order to see the patient. In order to see the lactation consultant when more help is needed. They also have a multi-bay milk expression room in the lactation center, which is open to employees. And these are all wonderful options, really, for a facility well on its way to becoming baby-friendly. For designers on the line, we will include a link on our site to the Best Bed Beginnings program, as many of your prospective clients are actually working towards achieving baby-friendly status, and these examples are all key for supporting their lactation programs. Now that we've seen examples for supporting breastfeeding in the hospital, the next question is, how can we accommodate breastfeeding support networks, such as the one seen here, through facility design in the U.S.? Well, mothers who enjoy the privacy of a single patient room really seldom have the opportunity to meet and interact with other new mothers in the hospital. In this case, breastfeeding moms may not receive the advantage of peer support, which is really a key component shown to increase successful breastfeeding duration and initiation, of course. So this is a lactation center at Southern Regional Medical Center in the metropolitan Atlanta area. For the past year, Southern Regional has allowed Powerful Petals, a free breastfeeding education support group, to use this space for their monthly meetings. We've worked hand in hand with Powerful Petals this year to provide them additional support through the March of Dimes grant. And this really is a wonderful way showing how a facility can accommodate pregnant and postpartum mothers. So these moms actually come in and they meet with postpartum mothers, pregnant mothers in the lactation room or conference room that is on the mother-baby ward. Here's another example. This is the local church that we worked with last year to pilot their Moms and Babies Ministry peer support group. So the church provided this remote nursing room for mothers who were not comfortable breastfeeding in the sanctuary during service. The same space was used by mothers and babies during the week for social meetings. Mothers who attended were either on leave from work or stay-at-home moms. And then this leads me to our workplace initiatives. According to the CDC, working outside the home is related to a shorter duration of breastfeeding, and even the intention to work full-time is significantly associated with lower rates of breastfeeding initiation and shorter duration. While some mothers are able to make provisions to remain with their babies after returning to work or to telework on a full or part-time basis, the majority of mothers really do not have this option. And whether it's not allowed or simply infeasible to take the baby to work, we really have to come up with other options for how to provide breastfeeding support to working moms. Until recently, options for expressing milk at work were very few, leaving mothers with undesired, unsecured, and unsanitary options. However, the amendment to the Fair Labor Standards Act in 2010 requiring break time and a private lactation space for mothers really changed this outlook for employees of large companies. Many breastfeeding mothers are optimistic about returning to work, empowered with their rights in the workplace. But let's examine this amendment. The new employee rights card states, employers must allow covered employees, non-exempt from overtime pay, break time, reasonable break time to express milk each time she has a need to express milk, If paid breaks are available to employees, mothers may utilize these breaks to express breast milk. Also, the milk expression space, what it says is that it should be functional for expressing milk, shielded from view, free from intrusion, available as needed, and not a bathroom. Just a side note, healthcare coverage now includes breastfeeding support and supplies. So for more information, please see the link below, which will also be included on your handout. Now let's take a quick poll. How many people were aware prior to this webinar of the amendment of the Fair Labor Standards Act requiring a private lactation space that cannot be a bathroom? Trinity?
This poll has been launched.
Thank you. Okay. So I've noticed that as the year goes on and we continue the webinars each month, we have more and more who were already aware, which is a great thing. The word is getting out. Okay. Unfortunately, this is a common scenario that we have seen. Some employees are faced with this lactation room option. We actually visited a makeshift lactation room that was an IT storage closet. And in fact, the mother had to schedule her expression times around the availability of the IT manager, who had to unlock the room for her each time. And really, with all of the challenges of separating the mother and babies in order for the mother to return to work, this arrangement could be quite discouraging for many moms. I'd like to ask Julie and Kina to talk to us about the work that they're doing to develop solutions and also standards in this area.
Thank you, Tammy. Julie and I will discuss our new standard for lactation accommodation design. First, we'll present an overview of the development trends of worksite lactation accommodations and clarify the definition of lactation to include the distinction between milk expression and breastfeeding. Secondly, we'll define the criteria justifying a new standard that separates the activity spaces corresponding to milk expression and breastfeeding. Thirdly, we'll define milk expression activity space according to the new standard with 3 separate zones for hygienic milk expression. Fourthly, we'll provide examples of a new standard console and a milk expression room. And lastly, we'll present an application of the new standard milk expression room to serve restaurant employees. Here we show the development trend of worksite lactation accommodations over the past several decades. In general, when a breastfeeding mother returns to work and continues breastfeeding, she may need to express milk, either by hand or with a breast pump, to maintain her milk levels while away from her nursing infant. If her mother doesn't have formal accommodations at work, she will make personal accommodations in whatever way she can. Before the 1980s, mothers faced many barriers to express milk at work due to inadequate pump technology and lack of workplace support. For example, I interviewed a hairdresser that tried to breast pump when returning to work in the 1970s at a salon. She said that the only place she could pump was in the bathroom, standing up using a manual pump. She reported that it was very uncomfortable and cumbersome and that she did not do it for very long. She was not comfortable enough to ask her employer for a more suitable pumping arrangement. As a result, she did not continue breastfeeding for as long as she would have liked after returning to work. By the 1980s, some of these barriers were removed with the development of more efficient and portable electric breast pumps. This decade was a tipping point where a larger number of breastfeeding mothers took advantage of using these new breast pumps to maintain their milk levels at work. The more successful women were the ones who received management support in establishing a suitable space to pump. But even with a good breast pump, can you imagine the difficulties they faced in finding a private place in break time to pump? Many women privately expressed in makeshift places such as a vacant room, storage closet, or a restroom lounge. While some employers instituted lactation programs, there were no formal legal protections or building programs to remove time and space barriers for pumping. In the following decades, more and more women chose to continue breastfeeding after returning to work from maternity leave. In many instances, the culture and workplace mindset became more mother-friendly. In 2008, an AIA best practice was published that provided design guidance for workplace lactation accommodation. This best practice is widely used today. Also, in 2010, a federal law passed that requires employers to address time and space needs for milk expression and even requires health insurance to cover personal breast pumps to new mothers. Various state laws as well have laws protecting a mother's right to breastfeed in public and express milk at work. However, many existing lactation rooms do not distinguish between breastfeeding and milk expression at work. Many of these rooms also have signs depicting a breastfeeding mother when the room is specifically purposed for milk expression to comply with federal law. Later, we'll explain the importance of separating activities of milk expression from breastfeeding. Today, we propose a new standard for lactation accommodation that justifies separating lactation into two different spaces at work, one for breastfeeding and the other for milk expression. This separation is especially important for multiple users. It recommends separate signage for milk expression and breastfeeding. The new standard applies existing research and food handling and healthcare facility guidelines to drastically reduce the risks of hospital and workplace-acquired infections. It applies current best practices and hand washing protocols for milk expression. It also helps employers with design guidance to comply with the existing federal, state, and ADA regulations. Julie?
Keep in mind as we go through this material that our new standard is conscientious, that lactation refers to both breastfeeding and milk expression, and that those activities have different space requirements. Our new standard specifies 3 distinct spaces: milk expression, breastfeeding, and restroom as a result. Why separate milk expression space from the breastfeeding space? Well, the federal law requires that milk expression space be available when needed. When a mother can't find a private space to express milk when needed, she runs the risk of milk leakage and health problems such as engorgement, plugged milk ducts, or even breast infections. Our new standard recommends that the private milk expression space should not be used for other purposes such as breastfeeding, which could render the space unavailable for a milk expression break and make the employer out of compliance with federal law. A mother needs a private space to express milk, but not a private place to breastfeed. Many states protect a mother's right to breastfeed in public, so she does not need to have to seek a private space for this activity. In addition, our new standard recommends that breastfeeding not occur in the milk expression space to help prevent the risk of the mother's changing a baby's diaper. A mother has committed herself to provide for her infant, who has the weakest immune system, and jeopardizing that with the possible fecal contamination would be detrimental. And next, why do we separate milk expression from the restroom? Well, it's simple. The federal law requires it, and it improves disease prevention from human waste contamination and workplace-acquired infections. Finally, the separation between restroom and breastfeeding is to help improve disease prevention from human waste contamination and workplace-acquired infections. Our new standard recommends that baby changing facilities be provided in the restroom to prevent baby changing in the breastfeeding or milk expression spaces. Readily available signage to help call out these spaces is confusing, since it combines breastfeeding and milk expression functions, which need to remain separate. Our new standard supports the different spaces using a consistent and universal signage. On this slide, we're zeroing in on the milk expression space. Our new standard is requiring 3 separate zones: an express zone, a barrier zone, and a wash zone. To illustrate this, it may help to understand the milk expression activity that occurs within this space. A lactating mother needs to privately express milk every 3 to 4 hours to maintain her milk supply while away from her nursing infant through hand expression or the use of a medical pump device. She needs to wash her hands in the wash zone and clean off the surface in the express zone. And next, she'll partially disrobe in preparation to hand or pump express milk in the express zone. After milk expression for 10 to 20 minutes, she'll detach her pump parts, get dressed, and store the expressed milk in her own container. She'll continue by washing her hands and pump equipment in the wash zone and clean up in the express zone. The milk containers and pump get returned to her personal case and cooler, which she takes with her as she exits. Within a typical workday, she may repeat this 2 more times. Because this activity involves food prep of breast milk, which is with a medical pump device that's covered by health insurance or government programs, our new standard specifies these 3 distinct zones to satisfy food handling and healthcare facility guidelines. It also complies with hand washing protocols for milk expression. Any type food handling and healthcare environments are specified, a wash zone needs to be provided in the activity space. The wash zone needs to be separate from the express zone by including a splash guard or a 1-meter separation zone. These zones must be designed to prevent cross-contamination originating from sink splash or multiple users. This is evidence-based design from current research studies to reduce hospital or workplace-acquired infections and cross-contamination. Anytime a mother uses this space, she can feel confident that she is working in as clean of an environment as possible. Kina?
Thank you, Julie. Here we show an example of a console that complies with the new standard for multiple users. Its integrated design has everything needed for an optimized milk expression space that minimizes the risk of hospital and workplace-acquired infections between multiple users. It has a milk express zone with a seamlessly integrated solid surface countertop that also minimizes places for bacterial growth and can be easily sanitized between users. It also includes an attached washable ergonomic seat specifically designed for comfortable milk expression. It has a barrier zone, which includes a splash guard to reduce cross-contamination between washing and milk expression. It has a wash zone that includes hands-free fixtures to reduce disease spread from hands. It includes a top-fill soap dispenser for off-the-shelf dish liquid soap, which saves money and provides the appropriate soap for pump equipment washing. The sink has an offset drain to reduce splash contamination from the drain, as well as a ramp design to reduce splash. The sink also does not have a return drain to minimize places for disease accumulation. Its design provides off-the-shelf compliance with all applicable regulations and guidelines for healthcare, food handling, and ADA accessibility. It's optimal for multiple users, 1 user at a time. The design is simple and easy for routine custodial cleaning. A designer can use this solution for clients that have buildings with large populations of women that need to accommodate multiple users. These applications can be for large healthcare facilities, hospitals, government assemblies, universities, sports and performing arts venues. Next.
Our recommended floor plan design for our new standard milk expression console is accomplished in just 55 square feet. The milk expression space, which is noted in letter A above, provides a single user with everything they need in a private, hygienic space to express milk in the least amount of time and risk of workplace-acquired infections. The express room is ADA compliant and available for up to 6 women with 30-minute scheduled breaks every 3 hours during the workday. An employer can use numerous methods for confidential room scheduling, such as corporate scheduling software, free web-based calendar systems, or even paper-based scheduling at the HR office. The milk expression room can also include an attached vestibule, which is noted in letter B above, that is available 24 hours and 7 days a week for the locker storage of personal breast pumps that can be provided by health insurance, and milk storage coolers, microwave for equipment sterilization, or a refrigerator for milk storage. This floor plan is recommended for facilities such as large employers, retail outlets, conference centers, multi-office buildings, government assembly buildings, hospitals, universities, call centers, sports venues, and performance arts venues. Tina?
Thank you, Julie. Many hourly wage employees don't know about the federal provision for private space and break time for worksite milk expression and are reluctant to ask about the accommodations. Also, since the federal law does not provide design guidelines to comply with its requirements, many employers don't know how to optimally accommodate their employees. Here you see a simple layout of a milk expression room for fast food restaurant employees that satisfies the new standard, federal law, and ADA requirements. The federal law does not require the restaurant to have a designated milk expression room to accommodate its employees. It can use a makeshift place such as a storage closet or manager's office. However, these options can have drawbacks to the woman's dignity and privacy as well as restaurant operations. If the restaurant chooses to use a designated room instead, it can realize many benefits. For example, if the restaurant has more than one employee needing to express milk during a workday, a new standard milk expression room will help reduce disease spread and efficient break time for pumping between multiple users. It can also help reduce any negative impacts to restaurant operations by not co-opting other spaces such as a storage room or office. A designer can provide the restaurant owner with a complete milk expression room in just 55 square feet that can serve up to 6 different users, one user at a time. The floor plan shows the express room conveniently located in the employee break room. This express room includes a new standard console, trash receptacle, mirror, and towel dispenser. The mother uses her own personal breast pump covered by health insurance. In summary, as this application shows, the new standard for milk expression provides employers with an effective solution to worksite milk expression that optimizes legal compliance, worker productivity, and disease prevention. It also gives back privacy, dignity, and choice to the working mother.
Thank you, ladies. So essentially, Kina and Julie and their team have developed a standard that would enable designers to provide a space that complies with the Fair Labor Standards Act while also considering food handling guidelines. I think this is very useful for designers moving forward, and it's really essential to ensuring safe and effective use of such spaces. We started our research in 2011 by visiting with the CDC. With their wealth of information on breastfeeding support data and tools, we were confident that the CDC would provide great guidance for starting a lactation program, and they did. We started by meeting with architect Liz York, author of Lactation Room Design, which was published in the American Institute of Architects' Best Practices. Liz is also a mother of breastfed twins. Liz explained that she is breast milk in the very office that you see here, and she shared guidelines that they are currently developing for determining the number of lactation stations necessary. For every 100 women in a building or 200 employees, both male and female, according to the CDC's ongoing study, there should be one lactation station, estimating that 4 women could share one lactation station each day. This is an example of one of the rooms that they provide at the CDC, and I will mention that along with several lactation rooms available on the campus that we visited, they also provide on-site child care, a full lactation support program led by a lactation consultant. This consultant facilitates group meetings, and she's also available for consults for employees and for spouses of employees. She provides hospital-grade pumps for each room, as well as supplies. Now, this is an example of one of the rooms that we visited, and I'll just walk through. Liz recommended providing a comfortable chair on casters for ease of movement through the space. She recommended a sitting height work surface, a footrest, a sink, and preparation counter. She also recommended breast milk cold storage and supply storage. Some women choose to resume work while expressing milk, although the employer is not permitted to make this a requirement. And so Liz actually suggested that for women who choose to continue working, like to bring a laptop to the room and continue to work, this work surface that would accommodate not only her pump and supplies, but also a space to work. Let's do another quick poll. How many attendees plan to participate in the development of a lactation space this year?
This poll has been launched.
Okay. We'll share the results. Okay, great. Well, from our initial research, we did develop a checklist, required versus optional components. The key here is to note that only a private enclosure, a lockable door, and a chair are actually required at this time, and then all other amenities are optional. Here's another case study that really shows that a lactation room can be developed even on a very small budget if the space is available. This is the lactation room at AmeriGroup's corporate office here in Atlanta. Note that this room includes is a variation from the room that we just showed from the CDC. A sink was not available for the room, but mothers used the nearby restroom sink, and they still appreciated the space. Because the room was developed with the lactation program for breastfeeding support, it also included a bulletin board and binder to share information about lactation resources available to employees. Nurse Kiana Ayers, who championed this program, provided some tips for initiating a successful program and a successful room. For mothers watching the session or listening, attending by CD, she suggested doing your homework first and then approaching your Human Resources Department with the information. The business case for breastfeeding is always a great place to start, and you can find these helpful links on our website. Next, she suggested looking for a vendor who could provide the pump, the supplies, and also the support to employees. She suggested including all those potential costs and presenting this information for HR's review. She also suggested setting a timeline for the employees to make or for a decision to be made, and then also for the preparation work and a launch date that would actually allow the room to be open and the program to start. Finally, in large companies like AmeriGroup, Kiana suggested identifying a method for communicating program information, stating that there may be new or expectant mothers who are unaware that the room exists and still pumping or planning to pump in their car or even in a restroom. So it's important to communicate everything about your lactation program to all employees. This room was all achieved on a $500 budget. And since the refrigerator was donated, they were actually able to afford a fountain to add to the ambiance of the space. For mothers who are listening or attending, Kiana has granted us permission to share her email address with you in case you have questions on how to get started with the lactation room in your own office. So if you would just email us, we would be happy to provide you with her email address after the webinar. Finally, I'd like to ask Melissa to tell us about the work that she is doing and has done in developing lactation room solutions.
Thank you, Tammy. So again, as we've heard quite a bit before I started my portion of the presentation, these are several factors that we wanted to incorporate into our mother's room, as we call it here in our working showroom. Again, referencing back to the incorporation of Section 7 of the Fair Labor Standard Act, we wanted to make sure that in our mother space and included into the lactation design that we provided a hospital-grade pump. We wanted the overall space to have a reflection or an emphasis on relaxation. So again, as Tammy discussed before, an employer cannot expect a lactating mother to work while she is expressing milk. So we wanted to take it a step further and really make sure that that space gave the impression or a good feeling of relaxation. To provide additional acoustical privacy, we wanted to provide sound masking around the room and provide the user of the space the ability to listen to music or perhaps even watch a video loop of other design ideas of lactation rooms and or infant health benefits of breastfeeding. We wanted to provide storage that is locking for the user so that they could store their personal effects, breast pumps, or even robes, and to have an area in this space to store reading material that, again, is focused on women's health, breastfeeding, and parenting. So two scenarios we're seeing here are actual spaces that can be used as thought starters. They're in our showroom today of what could be a perfect space for a lactation room. The first here on the left shows, again, a chair, very comfortable chair on casters that can roll about the space with a footrest that can be raised for additional comfort. An employer-supplied breast pump of hospital grade is situated adjacent to the chair, and across the room at a safe distance is a sink and counter, a space for prepping materials and cleaning the breast pump materials as well. Lockable storage underneath, and even supply storage, again, for pump, other personal effects, even a robe can be placed here. Across the room, for those mothers that would like to work while expressing milk, there is a wall-mounted television screen that can be linked directly to their computers, or they can watch a loop video. In the second image on the right, slightly different application in a smaller footprint, again, still providing a very comfortable chair on locking casters. Supply storage is immediately adjacent to the space, and a hospital-grade breast pump, as well as a small table across the room. In this space, as a thought starter, I'm showing a 7x7 solution here, and again, this room is designed to accommodate one user at a time. Lockable storage, both overhead and to the side, have been provided so that multiple users can have their own dedicated personal space. The following criteria have been accommodated in this space. Again, the personal storage, supply storage, either overhead, ergonomic seating on casters, technology, outlets for plugging in breast pumps and other materials requiring power, and cold storage for milk. This is the same room showing on the left the plan view to give you an overall feel for the space, and then of course the elevation. In this space, the 8x10 solution is slightly larger. Again, this room accommodates one user at a time. Lockable storage is still accommodated here in a slightly different configuration, but giving the space an overall more open feel. Again, the users of this space have their own dedicated personal area to store their items, and across the room at a safe distance is where there is a countertop to prepare their pumps for use, or to disassemble them and to clean in the wash station. Again, trash receptacles are provided, a refrigerator for cold milk storage, and even a mobile storage unit. On this slide to the left, to give you the overall feel, again, for that 8x10 overall layout of the space, and the elevation to the right. In this space that is much larger, an overall size of 12x19, what we're showing here is a multi-bay milk expression room. Each space can accommodate, of course, one user at a time, the overall space being able to accommodate 3 users at a time. In this larger shared space, we have provided lockable storage, personal storage for each user. And the fronts that you can see in the top image, as well as the dividing walls, are simply a movable wall. The door fronts will lock and are visually private as well. Several amenities have been accommodated into this space here. As mentioned previously, the personal storage. There is supply storage either above the countertop, which you can see here, or beneath. An ADA sink. Refrigeration was provided in the general area. Trash receptacles, again, in the general area. There are recliners in each of the space, although not necessary to have. But the feedback we've received when working with customers is that they do like to have a chair that has some flexibility and give, obviously not to be able to recline all the way. There are also media centers in each space for the individual users, again, for their own personal use, whether they're looking at pictures of their own children as they're expressing milk, or if they are conducting work. And charging stations of course, are accommodated in each of the spaces that you see. So again, plan view of that 12 by 19 space and the elevations. We feel that for all of the different scenarios that we have shown you in the thought starters, as well as the actual installation that is in our showroom that we will see here momentarily, these items that you see here can easily be accommodated in any of the spaces. We have actually taken each of these items, in the infection prevention station, a magazine rack, bulletin boards, a clock, again, a sound masking system, and an electronic room reservation system, and incorporated them all into our lactation design. We also feel that for the different designs that we can create through various furniture solutions, they can easily be accommodated in any of these scenarios, be it in office, healthcare facilities, airports, perhaps even learning institutions, even shopping malls, or any other type of retail establishment, and even amusement parks. Now we will take a look at a case study, which is our actual design in our space. So we transformed an existing room, which was a guest restroom, and in the image here, this is the before shot. In order to convert the existing guest restroom into our mother's room, there were several things that we needed to do. We removed, of course, the toilet and refinished the walls and flooring. We were able to utilize the existing water line plumbing wall, which helped to keep the cost down. We added overhead lighting because, as you can see in this image, the lighting is rather dim. And we added and or relocated duplex receptacles. In this plan view image that you see here, the overall size of the room is just above 111 square feet. We added a glider recliner chair, and again, the emphasis of this room was about relaxation and being calm and relaxed, with the hopes to really optimize each milk expression session. So, as you see here, this chair does have heat and massage, although not necessary. Adjacent to the chair, we've provided a mobile table to either store a breast pump during use or place a laptop on. Across the room from the chair, we've provided lockable storage for each of the users to lock their personal effects with a TV above that they can either use to watch a loop video or utilize the DVD player that is in the room and play music during their expression session. We have a wall-mounted magazine rack across the room with materials pertinent to infant health, benefits of breastfeeding, and parenting. Across the room from the chair, we have our ADA height sink, and adjacent to it, a refrigerator for cold storage, cold milk storage, and a trash receptacle, all housed underneath a solid surface. Overhead, we've provided additional storage for cleaning supplies that are supplied for mothers to use. These two images show you the renderings that were created of the actual space itself from two different angles. And in this image, we see rough photography of the space. So there's your solid surface, work surface, with just a hole in the top in order to drop trash down to the receptacle below. Again, another view, microwave offered, and lastly, the professional shot of the room. Breast pump provided by the employer, cleaning supplies, there's your locking storage there across from the seating. So in summary, the overall cost of the furniture, which of course can fluctuate depending on the actual layout, that is specified can run anywhere in this ballpark. Where there was, of course, construction and labor involved in converting that existing guest restroom into the mother's room that you see today, adding some accessories to just help to warm up the space a bit, some of the accessories we had on hand, so this overall cost is very low. Thank you, Tammy.
Thank you, Melissa. And it's great to see the breakdown. Many of our attendees will ask us about budgeting and cost. And so we have shown a couple of case studies with a breakdown. For more information, we will provide you the contact information of all of our presenters, and you may reach out to them directly to learn more about the solutions that they presented. Now we have time for one last poll. Is there currently a lactation room in your workplace? Trinity, if you would please launch the poll.
The poll has been launched.
Okay, great. Okay, I'm going to close the poll and share the results. Okay, I'd like to move to our last slide. And just to show you the presenters on the line, we will take questions at this point. We do have a couple of questions that have come in, and so I'll go ahead and read those and allow our presenters to answer. If you do have a question, please feel free to post the question using your question button. Okay, so the first question is, what were the 3 requirements for a lactation space? A private enclosure, a chair, and what? Well, if we are referring back, I'm actually going to go back, take the slides back. If we are referring back to our checklist, now in terms of the law, Kina, while I'm moving backwards on the slides, if you could tell us in terms of the law, the requirements, I'll take us back to the checklist.
Okay, thank you, Tammy. The law does not require, doesn't specify the building requirements for the lactation room, except for it has to be a space free from intrusion and not in a bathroom and available when needed. And it needs to support the functionality of breast pumping. So if you go to the slide with the checklist, Tammy, the previous one with the law, that's where the caller needs to refer to in terms of getting the requirements for the space.
Okay, sure. And this is a link that will allow you to go directly to the Department of Labor's website and pull down the information card, which is where Kina pulled this information. And it talks about the specific requirements by law. From our work, we've determined that as long as there is a full enclosure, and so some people are actually required to bring in, 2 additional walls if they're going to set it up within an open space in the office so that the space is enclosed on all 4 sides, and obviously a locking door to allow the space to be free from intrusion, and then a chair. We also suggest a work surface, but just, for us to make it as functional as possible for expressing breast milk.
So that's correct, Tammy. So the law doesn't require walls. There's some instances with lactation rooms where the facility owner uses curtains. So there's lots of options to comply with the federal law, but the AIA best practice recommends additional, defines additional functional requirements for the room. So the designer can really work with the facility owner to come up with the best fit for the lactation room. So the whole goal is to make sure to remove the barriers to breastfeeding when a mother returns to work if she needs to pump. So the law is really open to a lot of, it's very flexible in terms of what the building requirements are. So as far as needing walls and stuff, that the law doesn't require walls or locks, but the AIA best practice recommends it as far as improving and enhancing the functionality of the room. Thank you.
Thank you, Kina. We have time for one more question, and this one is really, aside from, I will note for this question that, which is, are these slides available after the webinar? We have made a handout available on SlideShare, and so we will forward you the link to this handout at the conclusion of the webinar. Okay, so then our last question really, I will take you back to our presenters. Our last question talks about the design process and how long it typically takes in order to design a lactation space.
I can help maybe answer this a little bit. First, I think it's really important to bring this question, pose this question to your client very early on so that it can start to be incorporated into the floor plan of the design. And as some of the solutions here showed today about the approximate square footage that it takes to accommodate mothers returning to work. The other thing that I would highly recommend is that it be located close to plumbing services so that you can include the sink. Although the sink is not required by law, it is something I think through the material that we present today would be highly recommended to maintain hand washing protocols and cleanliness in terms of the people using the space. Is there anything else, Kina, that you can add?
No, that's good.
And I did want to show one more, repeat this slide on the screen. We had the question of repeating the ratio station. So for every 100 women in a building or 200 employees, both male and female, from what the CDC is examining, they are determining that 4 women can share 1 lactation station each day. Thank you very much. We want to remind everyone to please complete the survey, which will pop up immediately following this broadcast in order to either request a certificate of attendance or to enter your AIA number for continuing education credit. We will also send you a link to the handouts from this presentation. If you are tuning into this presentation by the CD, we will include with the CD a link to take your quiz and to submit any information or questions that you have for our attendees, for our presenters. Thank you so much. This concludes the